Rush hour, any city, any time. As people head for work, they seldom wonder who the people are who are beside them or coming against them. Chances are there'll be a few people in every crowd who have a medical condition which we know as epilepsy.
I didn't develop epilepsy until I was in my early 20s.
I'm hoping to plan a pregnancy. Will I have any difficulties?
Apparently I'd had it when I was 6 months old.
Before I met Fiona, I knew nothing about it. I was ignorant about it.
Is there anything that I would do that would make my seizures worse?
Epilepsy is the tendency to have recurrent seizures. There are many different types and causes of epilepsy.
About 1% of the population has epilepsy, and it is estimated that about 5% of individuals will have a seizure at some point in their lifetime. Although common in childhood, epilepsy can begin at any age, and we also appreciate that epilepsy quite commonly begins in the older age group. An individual's susceptibility is likely to be determined by inbuilt or genetic factors and acquired factors such as previous brain injury.
There are many different types of seizures. The most familiar and the most frightening type of seizure is the tonic-clonic convulsion. This was previously known as a grand mal seizure. In focal epilepsy, a simple partial seizure is said to occur where there is no alteration of awareness, and a complex partial seizure occurs where there is some alteration in awareness or consciousness. This alteration may be subtle and sometimes go unnoticed.
If you come across somebody having a seizure, there's no need to panic. Stay calm. Move any furniture or sharp objects out of the way. Cushion the person's head with a pillow or a folded up coat or blanket. There's no need to restrain the person. Don't put anything into the person's mouth. When the seizure is over, turn the person on their side into the recovery position. Make sure to tilt the person's head backwards. There's no need to call medical assistance unless the seizure lasts longer than a few minutes or is different from the usual type of seizure, or if the person has sustained any injury. Stay with the person until they have fully regained consciousness.
The diagnosis of epilepsy is based on the history provided to the doctor. An accurate eyewitness account of the seizures or events is often invaluable in providing information from which the doctor can make an accurate diagnosis.
Could you like to tell me what you experience each time?
Well, before I actually get the actual spell, as you call it, I get kind of a taste in my mouth. Mm-hmm. It's just kind of I associate it as a warning. So whenever I get that, I kind of tense up a bit first. Okay. And then my eyes kind of go all hazy a bit. And I'd scream out then. I wouldn't know where I was.
And she has that terrified look on her face, you know, and her eyes go slightly to the left. Mm-hmm. And she just can't hear anything. We just go over and try to soothe her out of it and chat her out of it and try to loosen her hand. And then when she comes out of that, then she's just very tired and white and agitated.
And is she confused after?
She is. She's always confused and tired, you know. But she's not aware of us being there, really, you know. She doesn't know what happens herself, you know.
The goal of treatment is to attain complete freedom from seizures without causing side effects from therapy which may interfere with the individual's quality of life. Some individuals have very hard to control seizures, and in these, achieving freedom from tonic-clonic convulsions and seizures which may cause sudden falling to the ground may be a very reasonable and worthwhile therapeutic goal.
The treatment of epilepsy involves general education about the condition and the use of medications known as anticonvulsants or anti-epileptic drugs. There are now many medications available, and these have obviously improved the quality of life for many individuals. About 60% of people will achieve complete control on medication without side effects.
Pull your hair up a bit.
Investigations help to define the cause and decide on the most appropriate treatment for people with epilepsy. EEG studies measuring brain waves recorded at the scalp may help determine the type of epilepsy and suggest where seizure activity might begin.
Okay, I'm going to put this light in front of you and it's going to flash and you will see some different colours. Okay. And I would like you to have your eyes closed.
A CT scan or an MRI scan may be useful in detecting any underlying structural abnormality of the brain. It's important to appreciate that epilepsy can exist in some individuals despite a normal routine EEG study and brain scan. Surgery is usually considered in individuals with uncontrolled focal epilepsy despite therapy with a number of anti-epileptic drugs. Not everybody who's assessed for surgery is deemed suitable, because evaluation for surgery is a complicated process involving special tests of memory and language function.
That's great, well done.
It also involves detailed clinical analysis, MRI scanning, inpatient video and EEG monitoring. And in addition, some patients may undergo EEG testing with surgically implanted electrodes.
Leave the lights down a small bit now, guys. That's it, right down.
The most common operation performed is the removal of part of one temporal lobe. And in many people with previously uncontrolled seizures, this can be a highly successful operation.
White matter.
This man had epilepsy from an early age. He had surgery 2 years ago. Since then, his life has dramatically improved.
I had epilepsy all my life, and 2.5 years ago, I had surgery. I am now seizure-free, and one of my goals was that I got my driver's license. And 6 months ago, I passed my test, and my life has completely changed since the operation. I used to get a sensation in my tummy before this happened, and I'd be able to advise whoever was around me that I was going to go into a seizure. And within 30 seconds to a minute I would go into it. I'd start fidgeting, pulling at my clothes. My tongue might be sticking out. I would lose the colour in my face, go very pale. It would last for a minute or two. And at times, if you had a bad one, you'd feel very sleepy after it, and you'd want to go away and lie down. Since the operation, my job prospects have improved, my family life has improved, and after the operation, my confidence just soared. I just kept on looking forward to the things that I was going to be able to do, that I was never able to do. Because as you can see, I can drive now. Something I was never able to do. And I have a young lad, and he's Mark. He plays a lot of hurling, and I can take him to the matches. Don't have to be asking a neighbour for a lift. Feeling underconfident to people. And he really enjoys going to the matches with his dad. And it has really changed my life. My wife and my children can see the benefits of it.
Okay, Catherine, I'm going to check.
Some individuals with uncontrolled epilepsy who are not suitable for brain surgery may benefit from implantation of a device known as a vagal nerve stimulator, or VNS. This device is implanted under the chest wall with a lead which connects to the neck. It comes on and off automatically. Up to 40% of patients who receive the device will have a 50% reduction in their seizure frequency, and about 10% will have a dramatic reduction and be rendered seizure-free. The full effect may not be seen for a year or longer.
Okay. Now you won't feel anything. That's it, everything's working great. Okay.
Thanks.
Most women with epilepsy can expect a normal pregnancy and delivery, and have over a 90% chance of having a healthy baby. Nonetheless, there are serious questions to be asked.
I'm hoping to plan a pregnancy. Will I have any difficulties?
There is no reason why you can't become pregnant, but some studies would suggest that women who have epilepsy can have reduced fertility.
Should I stop taking my medication?
No, you should continue taking your medication throughout your pregnancy. Suddenly stopping taking your medication is dangerous and can lead to seriously uncontrolled seizures. None of the drugs can be considered to be 100% safe,
But some of the recent studies would suggest that the newer anti-epileptic medications are safer, and it is important also to mention at this time that some of the drugs can reduce the effectiveness of the oral contraceptive pill. So it's very important that you are prescribed an oral contraceptive pill, including 50 micrograms of estrogen within that pill.
Is there a chance that my child will have epilepsy?
It depends on the type of epilepsy you have, Martina, and the type which you have is partial epilepsy. So the risk is quite low. But some women who have primary generalised epilepsy, the chance of their baby having epilepsy is approximately 10%.
Will I be allowed to breastfeed?
Yes, you may breastfeed, Martina, and this is important to mention. There are many myths around this topic, but generally speaking your baby will have been exposed to the medication during pregnancy, and some physicians would suggest that it is a good way of weaning the baby off the medication, although some of the drugs can make the baby drowsy, and if this becomes a problem, you just consult with your physician or neurologist.
When we got married, we had in mind already that we would have a family, and okay, we had a couple of challenges ahead of us because having a family meant that we'd have to think about the medication that Fiona was on and what effect it might have on the baby.
I think that's very, very important that people realise the side effects of the medication. And my neurologist at the time, he explained all that to me. He was a great man for telling you all the things, the side effects and whatever, and I used to take a lot of notes down.
The Republic of Ireland Epilepsy and Pregnancy Register was set up in Beaumont Hospital in 2001 and is located in the Royal College of Surgeons of Ireland Clinical Research Centre. Its main aims are to establish the safety of anti-epilepsy drugs in women who are pregnant, to find out whether seizure frequency could have adverse effects on pregnancy, to monitor the rate of preconception folic acid in pregnant women, and to educate people about epilepsy and pregnancy.
This may enable women who have questions or are anxious about epilepsy and pregnancy, and we'll be able to give them preconceptual advice or advice in pregnancy or advice after pregnancy relating to epilepsy.
Fiona and William now have 2 children, but they're very conscious that even for ordinary everyday things they have to take common sense precautions.
The first thing was to get a guard up around the fireplace, just in case and the baby fell. One of the important issues when you have a baby is that you don't bath it alone. You have somebody with you, and the best place to bath the baby is on the floor. When you're holding the baby, you don't bring the baby up the stairs on your own, because this is very important in case the baby slipped or in case that you had a seizure.
This man was on medication for many years. He was eventually accepted and recently had surgery, and he describes his post-operative experiences.
I had surgery, and after getting out of hospital I was recuperating for 6 or 7 weeks. Everything went very well. I'm still getting occasional headaches, but they pass very quickly. The surgery, even though it was a daunting prospect, wasn't as bad as I thought it was going to be, and now I haven't had an attack since. I'm still on the drugs, but gradually they will be decreased. So I'm very hopeful that in 2 years' time I will be free of epilepsy. So all in all, I'm very pleased.
Many people with epilepsy need constant reassurance about what they should and shouldn't do while their seizures continue.
I really enjoy swimming. Am I alright to continue with this?
Yes, you certainly can continue to swim. You can continue to do most of your ordinary daily activities. Now with swimming, you should swim in a swimming pool rather than in the sea. And you should always wear a brightly coloured swimming hat and identify yourself to the lifeguard and say to the lifeguard, I'm the person wearing the pink hat or the purple hat. And swim with somebody else, who, you know, a friend of yours who recognises that you have epilepsy and knows what to do during a seizure.
Is there anything that I would do that would make my seizures worse?
Well, there are certain triggers in some people. In some cases, some women report that around the time of their periods they may have a seizure. Now, this mightn't apply to you, but it's a good idea to keep a seizure diary so you can look at your seizures and see is there anything like that might be causing your seizures.
Is there anything I can do to make changes at home?
Well, most people's houses are perfectly safe, but there are a few simple things. Like, for example, upstairs in the bedroom, it's a good idea to push the bedside lockers away from the bed, or if there's any lamps on the bedside lockers, to keep them away. If you have seizures at night time, and I don't know does this apply to you, but if you have seizures at night time, you should use a safety pillow, and you can get these from Brainwave and also from some healthcare shops. In the kitchen, avoid trailing flexes. It's good to use a cordless kettle and a cordless iron, for example. And don't carry pots of boiling water across the table. It's best to bring your plates over to the cooker.
Valuable information about epilepsy is available through the Irish Epilepsy Association Brainwave. Many people have epilepsy before the age of 10. Although the vast majority of children with epilepsy can complete mainstream school, they sometimes have difficulty in concentrating and learning new information. Teachers and parents may have lower expectations for a child with epilepsy. It's important, therefore, that teachers are informed about epilepsy and know what to expect from a seizure.
Is there anything in particular we should know about Michael or his health?
I'm glad you asked me that, Mr. Murphy. Since Michael was 10, he was diagnosed with epilepsy. Now he takes occasional tonic-clonic seizures, but he's on medication, he's responding very well, and the hospital are very pleased with him.
And one other thing, I'm glad you told me, because if you don't mind, I'd like to be able to tell his teachers about this in case something does happen.
Yeah.
Would that be okay?
Oh, very much so, yes. In fact, I would be very keen. I would hope that you would be able to inform his form teacher and any of the class subject teachers that he would have. I would like them to be aware of the situation in case anything arises, so they know what's happening.
Okay, we'll do that. That's fine. Oh, great. And what about after-school activities? Would he be able to take part in those?
Well, there are no restrictions. He's able to do everything, and in fact, he's very fond of swimming, and he's hoping to get involved in swimming here if you thought that was okay from the school's point of view.
Absolutely no problem. There's always a lifeguard in the pool, so that's no problem at all.
Some studies suggest that it can be difficult for a person with epilepsy to get appropriate promotion at work or to maintain employment. This in turn may lead to difficult working relationships or even depression. However, most employers are sympathetic and supportive towards their staff with epilepsy.
Well, as an employer in what is quite a large organisation, I certainly don't have, or the organisation doesn't have a difficulty in employing people who have epilepsy. It wouldn't be one of the first considerations that we would have.
I had to explain to the management what had actually happened, and they were a bit concerned about it. And unfortunately, they took the stance that I had to change over some of my roles in the job. And unfortunately, that reduced my self-esteem.
There are always different things people have to look at in choosing their career, and there would be elements if people would have to consider if they had epilepsy in terms of applying for certain positions.
An awful lot of employers don't know anything about it, and I think it's in everybody's right, people with any disability, if they go to the management and tell them that they should understand.
If you do have somebody with epilepsy within your organisation, big or small, if people are aware of it, and if they're aware of what to do, it's not rocket science what you need to do when somebody has a seizure, and once you know what to do when that happens, it's not an issue after that.
Epilepsy affects all people of all ages in all walks of life, but epilepsy can be treated and controlled. Here's Dr. Delante again.
As we have seen, epilepsy comprises a group of disorders which affect the brain and which can cause recurrent seizures. With appropriate multidisciplinary treatment, individuals with epilepsy and their families can be helped to lead as productive and full a life as possible.